several cycles of chemotherapy or immunotherapy, you'll have scans to see whether your treatment is working. Your doctor might tell you that you have a partial response, stable disease, or progressive disease. But what do these terms actually mean? How much tumor shrinkage counts as a response? What if your tumors haven't shrunk but haven't grown either? Today, I want to explain how treatment response is measured in mesothelioma, what the different response categories mean, how modified criteria work, and what response means for your prognosis and your next treatment steps. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice, but understanding your response assessment helps you interpret your scan results and know what they mean for your treatment plan. So let's start with why measuring tumor response is so challenging in mesothelioma. Most cancers grow as discrete masses or tumors that can be measured in standard dimensions: length, width, and height. Radiologists measure these masses on CT scans and calculate whether they've grown, shrunk, or stayed the same. But mesothelioma is different. It grows as a sheet or rind along the pleural or peritoneal surfaces rather than forming discrete round masses. Measuring sheets of tumor is much harder than measuring spherical tumors. Early mesothelioma research used standard RECIST criteria. RECIST is an acronym for Response Evaluation Criteria in Solid Tumors. It was designed for cancers that form those discrete masses, but applying that to mesothelioma's diffuse growth pattern was problematic. And that led to the development of modified criteria specifically for mesothelioma. The modification measures pleural thickness at multiple locations rather than trying to measure tumors as three-dimensional masses. So modified RECIST works for pleural mesothelioma by radiologists identifying 6 measurement sites on CT scans. That's 3 sites on each of 2 different CT slices. And at each site, they measure the perpendicular distance from the chest wall to the lung, which is essentially gauging the thickness of the pleural tumor rind. The 6 measurements are added together to create a sum, and this baseline sum is recorded. After treatment, the same measurement sites are remeasured on follow-up scans, and a new sum is calculated. The change from the baseline determines the response category. Now, before I get into the details of those categories, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. And if you have questions or there's a topic you'd like to see addressed in a future video, put a note in the comment section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. So, the response categories. It starts with complete response, or CR, which means all measurable disease has disappeared and there's no visible tumor on scans. This is extremely rare in mesothelioma. It almost never happens. A partial response, or PR, means the sum of measurements has decreased by 30% or more from the baseline. For example, if your baseline sum was 100 millimeters and your follow-up sum is 65 millimeters, that's a 35% decrease, which represents a partial response. A partial response indicates that your treatment is working and your tumors are shrinking significantly. This is what you hope for. Stable disease, or SD, means the sum has changed by less than a 30% decrease or less than a 20% increase. Your tumors haven't shrunk enough to count as a response, but they haven't grown enough to count as a progression. Stable disease might not sound good, but for mesothelioma, it's actually a positive outcome. Keeping the disease controlled without growth is valuable. It means treatment is preventing progression, even if it isn't shrinking tumors. Progressive disease, or PD, means the sum of measurements has increased by 20% or more from the smallest sum recorded. It could also mean that new lesions have appeared. That's new tumors in locations that didn't have disease before. Those always count as progression, regardless of what your measurements show. So, for example, if your baseline sum was 100 millimeters and you responded to treatment with your sum decreased to 70 millimeters, but now your follow up scan shows the sum increased to 85 millimeters or more, that's a 20% increase from the lowest point, and it counts as progression. Progressive disease means the treatment being used isn't controlling the cancer, and the disease is growing despite treatment. How do these response categories translate to outcomes? Clinical trials show clear relationships between response and survival. Patients who achieve a partial response live significantly longer than those with stable disease, and patients with stable disease live longer than those with progressive disease. In the Checkmate 743 immunotherapy trial, patients with a partial response had a median overall survival of over 30 months. Those with stable disease had a median survival of 18 to 20 months, and those with progressive disease had a median survival of under 12 months. So the response category is both a measure of whether treatment is working and a prognostic indicator of likely survival. What about PET scan responses? CT scans measure anatomic changes, which means the size of the tumors. But PET scans measure metabolic activity, which is how active the tumor is. Response can also be assessed by these changes, which are measured in the standard uptake value, or SUV. When metabolic response is complete, it means all previously measured PET active disease has become inactive, with no remaining areas with elevated SUV. A partial metabolic response means a significant decrease in the SUV, typically 30% or more decrease in SUV max of target lesions, or a decrease in the number and intensity of PET active areas. Stable disease means there's been minimal change in SUV, and progressive metabolic disease means an increase in SUV or new PET active lesions. Sometimes anatomic and metabolic responses don't match. Tumors might shrink on CT, that's anatomic, but remain PET active, which means there's been no metabolic response. Or tumors might stay the same size on CT, but become less PET active. That would mean a metabolic response without an anatomic response. Generally, both types of responses are positive signs. Discordance between them makes the interpretation a little bit more complex. For immunotherapy specifically, there are special considerations. Immunotherapy can cause what's called a pseudoprogression. That's where tumors appear larger on scans due to immune cell infiltration and inflammation rather than from actual tumor growth. It can definitely make the disease appear to be progressing when actually the immune response is what's attacking the tumor. Pseudoprogression is uncommon, but it can occur in the first few months of immunotherapy. Because of this, oncologists sometimes continue immunotherapy for 1 or 2 more cycles, even if scans show apparent progression. Then they rescan to see if the progression was actually pseudoprogression. If tumors continue growing on subsequent scans, it's true progression and the treatment plan should be changed. What happens based on your response category? If you achieve a partial response, your treatment typically continues with the same regimen. You're benefiting, so keep going. Scans are repeated every 2 to 3 months to monitor continued response, and treatment continues until progression, intolerable side effects, or completion of the planned treatment course. If you have stable disease, the treatment usually continues. Stable disease is disease control, and that's valuable in mesothelioma. Again, you'll have scans every 2 to 3 months to monitor for continued stability. If you have progressive disease, your treatment plan typically changes. It means that your current regimen isn't working, so continuing it is futile. Options include switching to second-line chemotherapy or immunotherapy, pursuing clinical trials of novel agents, or transitioning to supportive care if you've exhausted treatment options and aren't well enough for further therapy. The exception to these is possible pseudoprogression with immunotherapy. Again, oncologists might give it 1 more cycle and rescan before declaring true progression. Now, what if you're feeling better, but your scans show stable disease or even slight progression? Symptoms don't always correlate with scan findings. Some patients feel dramatically better with treatment, even if their scans show only stable disease. Oncologists consider both scan results and how you're feeling when making treatment decisions. If scans show stable disease but you're feeling much better, continuing current treatment makes sense. If scans show a response but you're feeling terrible from side effects, treatment modification might be needed despite good scan results. What questions should you ask about your scan results? What response category do I have? Complete, partial, stable, or progressive disease? How much of my tumors changed in size or metabolic activity? How does this compare to what you expected? What does this mean for continuing versus changing treatment? When will the next scans be? If I have stable disease, is that good enough, or should we consider changing treatment to try for a response? To review, mesothelioma treatment response is measured using the modified RECIST criteria, which accounts for the disease's diffuse growth pattern. Radiologists measure pleural thickness at 6 sites, sum the measurements, and calculate the percent change. The response categories are complete response, partial response, stable disease, or progressive disease. PET scans add a metabolic response assessment, which is measured in SUV changes. The response category predicts survival. A partial response has the best outcomes, and progressive disease the worst. Treatment continues with respond or stable disease, but changes with progression. Also, immunotherapy can cause pseudoprogression, which is temporary apparent worsening. You can visit mesothelioma.net for information about monitoring mesothelioma treatment effectiveness, or call 1-800-692-8608 or use the live chat feature on our website to work with one of our patient advocates directly. As for me, remember to post questions below, and I'll see you next time.